Hi, everyone. Welcome to another segment of Wednesdays with Wendy. Thank you so much for being here. My name is Wendy Garvin Mayo. I am the founder of Shape Partners. Today, we have a special guest here with us today, Hayley Dunnack. Hayley Dunnack is an oncology certified nurse, as well as a PhD candidate from the University of Connecticut. And today, she is going to talk to us about give us an overview of oral health symptom management for caregivers. So with that, I'm going to hand it over to Hayley. Hayley, thank you so much for being here with us.
Thank you for having me. This is great. All right, so thank you again, Wendy. So like Wendy said, my name is Hayley Dunnack. I am an oncology nurse. I work for Hartford Healthcare Cancer Institute, so right here in Connecticut. I'm also a PhD student at the University of Connecticut in the School of Nursing. So I'm going to talk to you a bit today about oral health, especially during cancer therapies, why it's important, and kind of some management strategies that you can use at home. So for myself, this is a really important topic. I see this issue across lots of different cancer populations, for different treatment reasons, for different types of cancer. And so oral health and maintaining good oral health during cancer treatment is really important. And so I wanted to highlight that in this talk today. Also, in my PhD work at UConn, my current dissertation research work is actually in this area. So right now I'm doing some preliminary research into oral health symptoms in cancer patients, also some risk factors and what management strategies really work well for patients. And so I'm excited to get started with that. Overall, my goal is to help improve identification and the management of oral health symptoms during cancer treatment. So that's really my goal. That's what I'm here to do. So a lot of you are probably wondering, what's really the point? What's oral health side effects? Where are they coming from with cancer therapy? And so it's important to kind of think about the science that's behind these oral health side effects. It really depends on the cancer diagnosis, because that will dictate the treatment that the patients are going to get. It also depends on the treatment and where it's being directed. So for example, there's a couple different types of treatment that relate to oral health a little bit more than others. One of those is chemotherapy. So in general, chemotherapy is more of a systemic treatment. This kills cells that are rapidly dividing, and so those cells include cancer cells or tumor cells. But also cells that are rapidly dividing include your hair follicles, your nails, but then also the lining of your mouth. And so that's why we can see some oral health side effects when you're receiving chemotherapy, because it's also causing damage to those mouth cells as well. Another treatment type that can cause some oral health side effects is radiation therapy. So radiation is a treatment that's given with some specialized machines. It directs radiation to a specific tumor area. So when your tumor is in an area that could include the oral cavity, so say someone's having their head or neck treated, around their esophagus treated, sometimes you can have some issues with the cells in the lining of your mouth as well. And so those side effects in the oral health area can develop. So what are some of these oral health side effects? What are different things that patients might experience in this area during treatment? So the number one side effect that we kind of think of when we think of oral health is something called oral mucositis. So mucositis is this inflammation in the mouth area. And it's also the mucosa of the mouth is kind of where the name mucositis comes from. Another side effect that you could see could be taste alterations. So that could include a metallic taste, a lack of taste, or lots of variation in your taste changes. So those kind of depend on the treatment that you're receiving and are more of an individualistic kind of side effect that you might see. Another side effect that happens pretty frequently is dry mouth. It's also called xerostomia. So you might see that scientific term in some of the literature that you read. And so dry mouth can be very frustrating. It's usually caused by damage to the saliva glands. And so that's why patients might not have as much saliva output when they're on treatment. And we'll talk about some management strategies for these. I'm just going to start with the overview of what the side effects are themselves to start, okay? Another oral health side effect that you could see is pain. So related to a lot of these other side effects are, that inflammation, maybe it's pressing against nerves, and that's why you have some pain. And so that could be an experience that you have as well. Other side effects could include dental cavities. So it could be an infection in your mouth that impacts your teeth. It also could be thickened saliva. So in addition to having dry mouth and less saliva, it can also change the saliva texture itself. So all of these oral health changes can lead to appetite changes and nutritional changes within a cancer patient throughout their treatment. So this can impact the overall health and the quality of life of that patient. A lot of these oral health symptoms actually occur in more of a cluster, and they're interrelated. For example, radiation therapy commonly leads to dry mouth, and then this limited saliva production directly impacts taste receptors. So then patients experience changes with taste kind of related to the dry mouth to begin with. And so it's important to recognize what some of these side effects are so you can see the best management strategies for them. So how common are these oral health side effects? Is it all the patients get them? Is it only a very few? Like I said before, it really depends on the cancer treatment and the diagnosis itself. Research does show that mucositis occurs in about 40% of patients overall who receive chemotherapy. So that's a pretty significant number. That's irregardless of which type of cancer treatment or cancer type that they have. It's just anyone who's receiving chemotherapy. So that's pretty prevalent. Other patients that are receiving radiation to maybe the head and neck area, it's pretty likely that all of those patients will have some sort of mucositis. And so kind of knowing who's at risk for these oral health side effects help clinicians like myself be able to recognize and treat these earlier in patients. Some studies also show that taste alterations can happen in about 70% of patients that undergo chemotherapy. So taste is something that's a little bit trickier. We don't have any kind of way to see a taste change, whereas we could more visually see it in a patient. So for this, we're really relying on discussions with patients and asking them how food has been tasting, are they getting enough intake, et cetera. So what are some things that patients and caregivers can look for in these oral health side effects? So the biggest things are, what are these signs and symptoms that can show us what's a more severe side effect? Because it is pretty prevalent in the patient population, we want to know, when should we be worried? When should we be concerned? And so some of the biggest things kind of relate to nutritional deficiencies related to the oral health side effects. So this can include an inability to take in enough calories. So that could be shown in weight loss. So a lot of the time, patients are weighed pretty much every day that they come in for treatment. And so it will depend on their treatment regimen, but usually that is monitored in a clinic setting, but you certainly could check it at home as well and keep track. Other things that can happen if there are sores in your mouth, if they become more severe and impact lots of different layers of the mucosa, which is the lining of the mouth, it can possibly bleed. And so that kind of shows us that there's more severe oral mucositis that we want to take care of as soon as we can, because it will be painful and you probably won't be able to then take in enough calories, then leading to weight loss. And so we don't want that to happen. We want to maintain everyone's weight while they're on treatment. Other things to look for, kind of like you're always looking for signs of infection. So looking for that temperature that's above 100.4 degrees Fahrenheit. We're always looking at that. Sometimes that's really our only sign of infection in patients. And so we want to be aware. Then other things that can happen if you're not having enough intake, sometimes you're not having enough water intake. And so that dehydration can show in dizziness or possibly a low urine output for those patients. So those are some of those more severe side effects that we want to look for and take care of as soon as we see them. So what are some questions you can ask clinical providers about oral health management? So there's definitely a few questions that it's good to ask either in a virtual setting or right there in the clinic when you're talking with your providers. So kind of off the bat, when you're getting usually your chemo education or radiation education, you can ask, does my treatment regimen put me at risk for oral health symptoms? is this something I should even look for? Is it going to happen? And so you can ask them, how worried are they that this could happen to me, and this would be something that I need to look for? And then if it is something I should look for, which symptoms should I look for? What should I be worried about? And then what can I do to prevent these oral health symptoms from happening in the first place? And so we'll get into a little bit of prevention talk in just a little bit. Other questions that you can ask include, is there something I can take for the pain? There's lots of different prescriptions, lots of different home remedies that can help you as well. But the key overall with the question asking with clinical providers is to communicate with them consistently about any side effects that you're experiencing. So some people are on treatment regimens that they're only coming in every other week or so, or every couple weeks. And so there's a big lag time in when they're actually seeing a provider from one cycle to the next. And so sometimes you can forget what kind of happens in that 3-week span. And so it's nice to have kind of like a tracking mechanism. So they have symptom tracker sheets that are really helpful for patients. And you can see, okay, which days were the sores in my mouth most severe, which days did I start to have dry mouth? And so you can kind of track those and see them so that in the next cycle you can proactively do some of the management strategies that we'll talk about to help alleviate those symptoms. So there's lots of good tips out there for oral health management. There are some resources on Wendy's website on Shape Partners that I will include my kind of oral health management best websites as well, just so that people can see them. But I did compile some tips just so we can talk about some prevention, management, and then ongoing care, even when treatment's done. So there are some really great prevention strategies. And the great thing is that a lot of them are very easy. There's a daily mouth care is really important. It's something that we don't really think about. Maybe you might be really tired and you don't feel like brushing your teeth. But it's definitely really important because this is kind of the main thing that helps prevent oral health issues, is this consistent daily mouth care. So this can include brushing with a soft toothbrush. We don't want to disrupt any of the mucosa too roughly. There's also baking soda and salt rinses. So it's usually about a teaspoon of one or the other or both in about 8 ounces of water. So that's something you can swish around and spit out about 3 times a day, usually after you eat. And so that's kind of rinsing out your mouth, making sure there's nothing left over that could lead to an issue with an infection. Drinking water about every couple hours or so is also good. So that's going to keep your mouth mucosa moist. It's going to make it so that you don't have those dry mouth symptoms. It's also going to keep you hydrated so we can avoid dehydration. So it's got a lot of good uses for it. Some other kind of like daily mouth care that you can do, using lip moisturizer throughout the day. So just regular chapstick works well. They also have saliva substitutes. So there's lots of different types that you can just get over the counter. So those might work, but most of the time, just plain water works just fine if you didn't want to buy anything. Hard candies are a great resource as well. So hard candies can help with the saliva production. Usually we recommend sugar-free because we don't want there to be a huge intake. If you're having lots of hard candies throughout the day, you're going to get quite a bit of sugar intake throughout the day. And so we want to avoid having too much of the sugar. And so if you have like a sugar-free hard candy, then you're going to help maybe mask a taste change that's happening. Maybe things usually taste metallic, but when you have the hard candy, it tastes a lot better. So you can use it for that, and you can use it for the saliva production because having those hard candies kind of induces that saliva production in your mouth. So it'll feel a lot better. If you're someone that wears dentures, cleaning your dentures after eating. Also flossing gently or using a water pick is a great option as well. And then another big thing is to avoid alcohol-based mouthwashes. So a lot of people tend to use that Listerine, but it's a little bit too harsh for cancer patients. So I would definitely recommend something that doesn't have an alcohol base to it. Another big thing that's helpful for prevention and is actually something that providers could possibly set up for you is regular dental visits. So sometimes even before we start treatment, particularly for radiation, we'll have patients who could be getting radiation to the mouth area go right to a dentist. And so that's to see, is there any teeth that need to be extracted before we even get started? Is there something that's in there that we think is going to cause a problem and make this an uncomfortable situation for a patient? And so it's really important that we have regular dental visits just in general in life, because your oral health is connected to your overall health very closely. And so those are some of the good prevention strategies that are out there. In terms of management, if you do end up having these oral health side effects, what are some things that you can do? Certainly continue that daily mouth care that I discussed. All of those things you can do throughout treatment, even if you have one of these side effects, because some of them help prevent and then also help manage the side effects. If you're experiencing pain, sometimes there's some topical agents, possibly like Oragel, that you can get right over the counter. There's some combination mouthwashes. A lot of people hear about Miracle mouthwash. And so that's actually a combination of Benadryl and lidocaine and Maalox. So that is something that would have to be a prescription, usually from a compound pharmacy. And the only thing to be a little bit careful with Miracle mouthwash, while it can be really great, that lidocaine can be a little bit numbing too much for patients. And so we don't want you to have an inability to eat properly and to swallow properly. And so we want you to try and time that out and maybe have it about 30 minutes before you're trying to eat, just so it's not completely numbing the throat so that you are able to swallow properly. Like I said before, pain medicine could be an option for you, whether if it's over the counter, like an anti-inflammatory like Motrin, or a prescription. So that would certainly be a conversation with your oncologist. Other things that are helpful for management strategies are some dietary recommendations, but we'll kind of get to those in a little bit. But some overall things will be high protein foods, high calorie foods that are soft or semi-liquid, because then it's not going to be uncomfortable to eat them. If you do experience dry mouth, having a humidifier in your room can be very helpful. And so that can help prevent the dry mouth from being too uncomfortable and to leading to mucositis in your mouth. And then, like I said before, drinking fluids is really important. That can help thin your mucus, help with the saliva. But it also is important to note that it's about 8 to 12 glasses of fluid per day. We usually recommend water, but if you're not someone who likes to drink plain water, you can spice up with some juices, maybe water down a juice, just so you're getting some of that intake as well. So those are kind of our main management strategies for during the actual oral health symptoms that you're having. So some of these oral health side effects could possibly extend into a time period that's called survivorship. So some people might not know what survivorship is. It's actually the time that starts from the diagnosis of your cancer through treatment and then beyond, even when treatment is completed. And so some of these oral health side effects can be called long-term side effects. And they can last even after treatment is finished. And that can be pretty common with certain oral health side effects, including dry mouth and taste changes, and possibly mouth discomfort, depending on what your treatment was. So the key is definitely to continue that daily oral care routine, even when you're done with treatment. And then also to continue to follow up with your oncologist, especially within that year or so time of completing treatment. And so it's all about keeping track of the side effects that you have, and then following up with your provider if there is something that's kind of an alteration from your baseline. So like I was saying, the oral health of a patient is really closely tied to nutritional status. So there's lots of different dietary recommendations for these oral health issues during treatment. So luckily, many cancer centers have a dedicated dietary personnel. So usually a registered dietitian will be associated with a cancer center, and then they can provide a consultation, they can provide ongoing help and support to those patients. They're a huge resource for us nurses because they have so much extra experience in terms of how much of a supplement drink is appropriate given the patient's weight. What do we want to maintain their weight at? They know all of that. And so it's really nice to collaborate with them. So some general advice that we can give includes water intake, increasing that water intake to stay hydrated during treatment. Also high protein foods, those nutritional drinks, those shakes that you see like Ensure and Boost, those are certainly great things to find. Usually they're high protein, high calorie, almost like a meal replacement. And so that's something to note, is that if you're not having any meals throughout the day, you're going to need to have usually about 5 or 6 of those boosts a day. And so a lot of patients think like, oh, I'll just have one in breakfast time, one in lunch, one at dinner, and that's enough. But it's not actually going to be enough to supplement what you normally would have had. And so it's important to speak with a dietitian about how many you should really have. And then eating small, frequent meals. So if you're someone who is able to eat well, but having a hard time, maybe you get tired when you're eating, or it's a little bit uncomfortable when you have to chew for a long time, it's good to try and break it up into a few meals a day instead of just the regular 3. You might try to have 5 or 6, eat every couple hours, even if it's just a small amount, just to be able to get those calories in. So there's definitely some foods that we say it's good to avoid when you're on cancer treatment therapies. So these could include food or drinks that are extreme temperatures. It can be painful, depending on what your treatment is, to eat or drink foods that are really hot or really cold. And then also, if things are really hot, it can damage the lining of your mouth. And we want to try and prevent that, because we already know that the chemotherapy or radiation to that area could be already damaging those cells. So we don't want to damage them further. Other things to avoid could be spicy or citric foods. So that could be like lemon or tomatoes. So those, if you do have sores in your mouth, those kind of foods can irritate those sores. And so, like I said, we don't want to make that any worse. Other things that can be irritants include alcohol or tobacco. So certainly during treatment, we tell patients to try and avoid alcohol as much as they can, and to try and at least cut down on their smoking, if not quit altogether. And what's great about smoking cessation, there is usually someone in a cancer center that can sit with patients and help them work on that, because smoking is actually tied really closely to taste alterations. So if you're able to quit smoking, you can possibly reduce your chance of having those taste alterations. So it's definitely really helpful for patients to try, for sure. So other foods that you want to avoid could be rough or coarse textured foods. So it's much better to have smoother or semi-liquid foods. So like those Boost and Ensure, smoothie drinks, things that aren't going to be uncomfortable to eat, mashed potatoes, eggs, things that aren't rough around the edges. If you do have dry foods, we do say it's best to try and soak them in bread or liquid or sauce, depending on like soaking your bread into liquid or sauce so that it's not really rough on your mouth. And then there are some certain ways to add calories into various cooking or meals that you do. So that could certainly be from those supplement drinks, but it also could be through things like ice cream. You can add ice cream to smoothies. That's going to give you a big calorie boost, and that will help as well. But also you can add things like sour cream, half and half, to sauce bases, and that can give you that extra boost of calories as well. So there's various tips to help manage taste changes. So like I said before, sometimes there's some treatments that can cause kind of a metallic taste in your mouth. And if that happens, it might be uncomfortable to use regular silverware, because that is metal and everything might start to taste metal if that's what you're putting in your mouth. So sometimes we recommend using plastic utensils, and that can alleviate that discomfort. Also using mints or gums or those hard candies to mask those taste issues that patients might have. That's an option as well. And then other things, we did mention that trying to avoid spices or things that are too spicy or hot, but you also might need to flavor your foods differently than you might normally would. So trying to spice it up and change up your spices might make things a little bit more tastier to you. So there's lots of different options out there, and there's a lot of great recipe books that are specific for certain cancer types or treatment types. And so those are a nice thing to try out, especially if you're feeling really unsure about what you can cook in the kitchen. It's nice to have a recipe book to try something new. And like I said, there's many of the cancer centers, at least in this area, and I'm sure throughout the nation, have a designated registered dietitian. And so they're really, really useful in terms of consulting and then working with them throughout their treatment, and then even beyond into their survivorship time as well. So I am going to put a bunch of resources on Wendy's website. I think she already has a few of them, but they include cancer.net. They have a lot of great patient and caregiver resources. The American Dental Association, they have a really great Mouth Healthy site. And then it's specific for cancer dental health. So that's really nice that it's specific for that. And then also chemocare.com is a really great resource as well. It breaks things down and makes things a little bit more simplified so that you can understand how to, maybe create that baking soda salt rinse for home and so that you can use it. And so kind of my 5 pearls for caregivers for oral health management. The first one is to try and create an oral health management plan for your house. So that could include that soft toothbrush, consistent water intake, and those hard candies to maybe bring around. The second pearl is trying to stock various soft or semi-liquid foods at home just so you have options. So you might not experience side effects right away related to your oral health. It might take a couple cycles of treatment. And so you might not be prepared to eat foods that are a little bit different than normally. So it's good to stock some options at home, like Carnation Instant Breakfast, things like that. They're going to get you the vitamins and nutrients that you need on a daily basis. And then you can go out to the grocery store and, look for something else that's different. Asking for a dietary consult early during treatment is my third pearl. Like I said, many programs have this as part of their standard of care anyway, but it is good to know, especially if you're someone that's going to be at higher risk for oral health changes, so that you can work towards, alleviating those symptoms early is really important. My fourth pearl is for caregivers to advocate for the patient, to monitor their symptoms, and then to empower them to bring up their concerns with their care team. So like I said before, sometimes we don't see patients every single day, depending on their treatment. And so there could be a couple weeks that go by and you are the caregiver at home that's seeing these issues happening. They're struggling with what they're eating. And then they get to their treatment and maybe things have kind of resolved in terms of the side effect. So they might not think to bring them up. So that's why it's really nice to have that symptom tracker so they can say, oh, look here, like it was really bad on these days. It certainly started to get better before I came in for my next cycle, but I want to make sure that that time period isn't as bad as it was last time. And so helping and advocating for the patient is really important. And then my fifth pearl for caregivers is to be supportive, even if it's frustrating. It's hard when you don't see a physical symptom sometimes, especially with taste, especially if you're the one that's cooking for them. That can certainly be frustrating. But try and validate their concerns and guide them to a solution. Maybe try different foods, maybe try different spices, or maybe look for a supplement drink that works for them, possibly better than the food that they're eating at home. And so there's lots of different resources out there. There's so many websites, but really your care team is one of the best resources because they'll know you the best, they'll know what's going on with your treatment. And so it's really important to have that communication from the beginning so that you can help avoid any major issues with your oral health during treatment.
Awesome. Thank you so much, Hayley.
Thanks.
That was great. That was a lot of great information. We do have a question in the chat.
Biotin, yeah. So that is one of the saliva substitutes. So the question was, do you recommend biotin? And that is one of the kind of general run-of-the-mill over-the-counter saliva substitutes is biotin. And so we do recommend that. It's hard. It doesn't work for everyone. So it's something that you might want to get a smaller bottle of to try at home and then see if that helps you. Water does a lot of the same stuff that biotin does. And so it's hard to say that it works better than water. I'm not sure if there's been a trial on that, but my guess is it would be about the same. So if you didn't want to purchase anything, I think water would be just as good. But I do see patients use it and they have said that it can be useful to an extent. Mm-hmm.
Awesome. Thank you for the question. And I have another question. I'm not in the chat, but if a caregiver has a loved one who's diabetic, are they at higher risk for oral health issues? Or
so in terms of being
chemotherapy?
higher risk, I'm not sure if they'd be at higher risk for the oral health side effects, but I do know that if they are having some of those nutritional deficiencies, you might notice it sooner in those patients because their blood sugars are going to be off. And so it'll be important for them to have a consistent eating and management strategy throughout their day to help avoid any of the diabetic side effects that could happen. Mm-hmm.
Okay. No, that's good. And do you recommend caregivers to do mouth assessments using a flashlight or
Yeah,
some
that's a
sort
great
of like
idea. So a lot
light
of the time,
source?
patients will say,
Uh,
"Oh, I feel like I have a sore in my mouth," and it's really hard for them to look in the mirror themselves to be able to see. So having a patient maybe like lie on the couch, and then kind of have them tilt their head up. You can use a regular flashlight, except no one has those anymore. So you could certainly use your phone because phones all have flashlights. And so you could get a better image of it so that you can describe it, especially if it's a mouth sore that happens in those weeks that you're not going to see a provider, or maybe things are virtual and so you can't quite show them exactly what it looks like, but you could describe it a lot better that way. That's a good idea. Yeah.
yeah, and pictures are
Hmm.
great. Patients always want to see
Exactly.
pictures, so that's good. Last week, 2 weeks ago, Dr.
Mhm.
Lynn Elchin was here talking about palliative care. Would it be advisable to get palliative care involved if one of your loved ones
Definitely.
started
So,
having
a
oral
biggest thing
symptoms?
for palliative care, that's all about symptom management. That's all about making a patient comfortable. And so, a lot of oral health side effects can have a lot of discomfort associated with them, whether it's because of the inflammation or because of an inability to get in enough calories. And so, they start to have those nutritional issues. And so, that's why it would be important to maybe get palliative care involved, especially if it's something that's creating a lot of weight loss, it's something that's creating a lot of anxiety around eating. That would really help to have them on board.
Yeah, no, that's great.
Mm.
And if a patient's on oral chemotherapies versus infusion, is it
Mhm.
a higher risk, or is it about the same, or just depends on what they're getting? What are your
Kind of
thoughts?
depends on what they're getting. A lot of the time, infusion chemotherapies and oral chemotherapies, they're both systemic. But from what I've seen in the research, it seems like those intravenous chemotherapies tend to have more of a risk for the mucositis. But it does kind of depend on the treatment. And there's lots of new oral chemos that are coming out. So there hasn't been a ton of research into specifically those oral health side effects just yet. So time will tell, but it's definitely something that could happen. But I definitely see it a lot more in the intravenous chemotherapies.
Yes, and Haley, can you please tell us what systemic means?
Oh, yes. So systemic means that it's going throughout the entire body. So chemotherapy works on all the cells that are rapidly dividing. So those include the tumor cells, those include the lining of the mouth. So that's systemic. Radiation is more of like a localized treatment. So localized meaning it's going right to where the tumor is. And so that means it's really not impacting the cells. Say we're treating like the neck area, it's not going to impact the cells in your feet. So something to note that way. So you wouldn't think that there would be nail changes or skin changes, etc. Mm-hmm.
Okay, nice. And what about thrush? Is thrush like a very common oral symptom that patients usually start with, or can it usually develop into something worse before thrush? Is thrush like an indicator?
So thrush is something that can happen. It's more of like an infection. So it's that candida, so that yeast that can build up in the mouth. And so that could be something that's a sign of infection for a patient. It kind of depends. That would be something to look for sure. It would be kind of like white patches in the mouth and can kind of start as that mucositis and that inflammation and turn into more of like that yeast infection in the mouth. But for that, you would definitely want to look and see with like a flashlight and, let the provider know. But as soon as they see that, there's some really great, easy drugs to fix that with. So nystatin is one. Continuing with that baking soda and salt rinse as well. So that's something that can help prevent it, but then also can help treat it.
Nice. Awesome. And should caregivers call the doctor at the first symptom of a mouth sore, or wait till the next appointment, or what's the recommendation?
So it kind of depends. So if it's someone that they have one sore, it doesn't sound like a lot, but if it's something that's really uncomfortable, you feel like you can't get through your day without thinking about it, you feel like you can't eat your food without thinking about it, or it's uncomfortable to eat, then we definitely would want you to call because we don't want it to interfere with your daily life. So that's the biggest thing. If it's something that isn't too uncomfortable and you feel like you can eat and it's not painful, then it's fine to wait until your next appointment. But if it's something that's interfering with your daily life, we definitely would want you to reach out.
Awesome. Well, thank you so much for this information. Great presentation. Thank you all for joining, and we will put some resources in the chat for you to refer to later on. Hayley, thank you so much.
Thanks for having me.